Hello, my name's Ethan, and this is my Practicum CEC video going over a shoulder impingement. So looking at an impingement, we're looking at the region of the shoulder, generally the shoulder girdle joints, the scapulothoracic, the glenohumeral, sternoclavicular, and most importantly for us, we'll be looking at the acromioclavicular because there's that subacromial space that leads to a shoulder impingement. Looking at musculature, we'll be looking at deltoids, pectorals, rhomboids, trapezius, all three of them, the teres minor and major, the latissimus dorsi, the supraspinatus, infraspinatus, scapularis, subscapularis, serratus anterior, and levator scapulae. Moving into our systematic assessment, we'll be looking at health risk appraisal first. She's a 19-year-old female is our patient. She works at a law office as a receptionist and interns for a courthouse, and then works at a dog treat booth at the farmer's market on the weekends. So there's a lot of extended periods of sitting during the week. And then additionally, she uses a lot of upper extremity motions throughout all of her jobs that get very repetitive. Um, then there's considerable and consistent mental stress that may cause tension up in those upper traps and make them overactive. Looking at recreation, she plays pickleball and bikes weekly, walks daily, and then does a lot of reading. So that's also that kyphosis type posture along with television watching. So that's kind of the upper cross syndrome that we could see in the future here throughout. Medical history wise, she has had right shoulder bursitis, so that could be some of the inflammation in that subacromial space, leading to that in shoulder impingement. And then there's a right biceps tendonitis, which is also inflammation in that subacromial space, which could lead to a shoulder impingement as well. Otherwise, she's got a knee dislocation in the past and a concussion. No surgeries, but she is on chronic migraine medication that constricts blood vessels in her head, so we could be worried about that. Moving into a static posture assessment, we're looking at the anterior view. You can see that there's the protracted shoulders with medial thumb rotation, and then the ankles are laterally rotated. Moving into the lateral side, you can see that there's protracted head, there's the protracted shoulders, medial ankles, and then the knees are forward leaning. So we can see that upper cross syndrome is very evident throughout here. Lastly, on the posterior side, you can see more upper cross syndrome with that protracted head and shoulders, and then the hands aren't even visible because they're so medially rotated, but the hips are neutral as well as weight shift and scapular um, distance from the midline as well as shoulder elevation. And then there's no head glide in either of these assessments for the static. Looking at the overhead squat assessment for our movement assessment, you can see initially the hand starts lower and then it drops as we go along with the forward lean. This is visible in the first, in the lateral view as well. We can see that arm drop, forward lean, anterior pelvic tilt, and then same thing in the last assessment. Okay. Then in the push-up assessment, we can see that there's some scapular elevation. In the video, it's hard to see, but there is scapular winging. Other than that, there's good back and head posture throughout the push-up. Moving into range of motion assessments, she did have decreased shoulder flexion by 40 degrees, the decreased range of motion in internal rotation by about 13 degrees, and then the external rotation was good as far as range of motion went. Strength assessment wise, we did 6 strength assessments. I did them for the rhomboids, which is this one. She had relatively weak rhomboids, or super weak rhomboids actually. They didn't really activate. There was a lot of compensation and it was just generally very weak. Same thing for this lower trap here. We did that lower trap test from the prescribed by the NASM textbook, and here there's a lot of compensation in this upper trap, and then it was just generally very weak as well. However, the latissimus dorsi did have minimal compensation, so there's generally no compensation there, and it was very strong, so I gave it a 3. So looking at the rhomboids, 1, middle trap, or middle and lower trap were a 1. There was a lot of compensation and a lot of weakness, and the latissimus dorsi was a 3. Moving into our last 3, I did the internal rotation, external rotation, and then serratus anterior. This internal rotation was very strong. There was no general compensations, and it looked very, very good, strong, and just normal activation through there. Moving into our external rotation, there was a bit of trunk rotation to try and compensate and a little bit of scapular elevation. So I gave it a 2 because it did in fact activate, but there was a lot of compensation with it. And then serratus anterior.
Yes, the next one.
Serratus anterior was very strong through this test. No compensation really, so I gave it a 3. Assessment findings, static posture, normal findings, just very neutral along, no general weight shifts or head tilts, anything along those lines. Range of motion, external rotation was normal, and then the push-up assessment had good posture through her head and back. And then the static posture, she had a lot of upper cross syndrome and a forward weight shift. And then the range of motion was decreased for internal rotation and flexion. And then scapular winging and elevation was very evident in the push-up test. Assessment findings for the overhead squat test, the right arm dropped a lot, so that was quite accentuated, and we could see that there. And then there's that forward lean and anterior pelvic tilt, and then we just went over NASM scores. So taking this, we have underactive muscles in the lower and middle trapezius, as well as rhomboids, so we'll be looking at those. And then overactive muscles from our manual muscle testing and just compensations in static posture and the movement assessments in the upper trap and levator scapulae. So this impingement may be due to weakness or past traumas. And then looking at upper trap compensation, it's due to weakness in the lower trap, middle trap, and rhomboids. Going into our corrective exercise continuum, I used inhibitory techniques to demonstrate through here. We did a minimum of 30 to 90 seconds, and I decided to do the upper trap and levator scapulae due to compensations and overactivity in the upper traps from the push-up test and compensations in the manual muscle testing. So here I go over it there. We've got overactive upper traps and levator scapulae because whenever we do something, it's coming up. So what we're going to do is we're going to use this to do self-myofascial release. And the way you're doing that is you're just sticking this, I can move this side. You stick it up into this upper trap area, and you're just gonna hold, and you'll hold until you feel just relief. It should take about 30 to 90 seconds depending on the lower end for your pain tolerance, whatever you're able to handle. But you just kind of hold it here, and you apply your own pressure, and you just hold it until it feels release. So here you go. Yep, and so we're putting it right into this upper trap. Levator scapular region. Go ahead and give it some pressure. Does it feel it's pressing? Okay. We're just going to hold that until it relieves. Yeah, moving forward into lengthening techniques, I also did the upper trap and levator scapular for 2 sets of 30 seconds doing the stretches for that. I did it from the push-up test with that upper trap compensation and then compensations the manual muscle test with like the external rotation and lower trap and then the rhomboids as well. So here's that. We're also going to do lengthening on the upper trap and levator scapular region. So the way we're going to do this is we'll do some static stretching for about 2 sets of 30 seconds. And so the first way we're going to do it is we're going to be here. We're going to put our arm behind our back and you're just going to go your head directly off to the side. And you'll just weight it down with your hand. And we'll hold it for 30 seconds. Yep, so hand behind your back, and just relaxing, and yep, and just weighting your head down. You're not pulling, just straight up to the side. And we'll hold it for 2 sets of 30 seconds. Is we're going to do a levator scapular stretch. So that's another muscle back here. So what you're going to do is you're going to turn your head 90 degrees, and you're going to look down like you're looking into your shoulder pocket. Yep, and then you're going to take that same hand on the same side, and you reach up, and you're going to weight down the top and the back of your head back here. And so you're just going to go ahead and weight it down, and you should feel a stretch through the back of your head. Okay, and then we're also going to hold this for 2 sets of 30 seconds on each side. All right, moving forward for my positional and isolated strengthening techniques, I did step squeezes for 2 sets of 10, holding for 2 seconds, and eccentric for 4, as according to the book. And then I did positional isometrics of shoulder extensions for 4-second holds for 4 sets of 4 reps at 25%, 50%, 75%, and 100%. And these are from weak manual muscle testing scores in the external rotators where we had a 2. And then additionally in the lower trap and rhomboids, we did it for there because those were both 1s. So here's those. Okay, so the first one we're going to do for an activation is we're going to be here, and I want you to be thumbs up, holding the band, and we're going to pull our shoulder blades back and pinch them. So we're really pinching through our scapula, and it's not necessarily an arm movement where we're just going out. I want you to keep elbows in and pinch those shoulder blades. And so we'll go out, and we'll hold for 2 seconds, and we'll do a 4-second isometric. We'll do 10 to 15 reps.
Okay. So thumbs up, thumbs out. Going and pinching these shoulder blades and pulling them back. Right, pulling right back to your knee. Good. Hold for 2, come back and forward. And go all the way forward again. All the way forward.
Awesome. And we continued that, and then I'll show the isometric.
Okay, so the next one we're going to do is I'm going to have you belly down. Yep. And we're going to do an isometric. So we're going to go, and I'll have you here, be thumb down, or thumb out, and we're going to have you push up, and we're going to hold for 4 seconds. We're going to go down and rest for 2, and then we'll go up and do it again. And what we're going to do is 25%, 50%, 75%, and then 100%. And we'll do this 4 times, okay? So go ahead and go up at 25% for 1, 2, 3, 4. Okay, go down, rest for 2 seconds. 1, 2, go for 50. 1, 2, 3, 4. Okay, go down. Rest for 2. 1, 2. Go up for 4. 1, 2, 3, 4. Try and bring this arm a little closer. 1, 2. Okay. And then we'll go up for 100. Ready? 1, 2. 1, 2, 3, 4. Okay. Rest.
Awesome. And the last one I did was my dynamic integration. I did a D2 pull as a flexion pull because it works some of those external rotator cuffs with the D2 flexion or with shoulder flexion, as well as those motions from the lower trap and middle trap in the back. So I started with the weakest band, and then I progressed to a harder band, and then I used a body blade for some little stabilizer actions through there with the butterflies. So here's this.
We're going to do the same D2 pull this time, except this was a stronger band, or the pink band's a stronger band than the orange, so this one would be a bit easier. So same thing, left foot back, right foot, or left foot forward, right foot back, thumb down, contracting, and our mid back and low back muscles, right in that middle and lower trap. And we're going to turn our thumb over as we come through. So we'll be here. Okay, through. And we'll do 10 to 15 reps this way. Awesome, good. So thumb down, and contract your mid and lower back. Really good. Yep. So contracting right through here for you. Keep that upper trap from going up, don't scrunch. Perfect.
So then looking at the progression, I just used a harder band to do it.
So the first integration I'm going to have you do is we're going to do a D2 pull. So you're going to step forward with your left leg, back with your right leg. We're going to be thumb down, and we're going to use our lower trap and middle trap to contract and pull back and up. And as you go up, you'll turn your thumb over. Okay. So it'll be here, and you're going to go up and over. The main things we want to avoid are we don't want to let this trap come up, and we don't want to scrunch up. So we want to keep it down, we want to be tall, and just come over. Okay, there you go. Good, so step left foot there, start thumb down, good. And then turn, stand tall, and pull back and over, contracting. Good. Yep, turn the thumb over. Really trying to keep that upper trap activated. Perfect.
Awesome. And the last one was that body blade with the butterflies as the biggest progression.
So a progression we're going to do from here for now. We're going to do that same split stance, and we're going to go ahead and do it with the body blade. So what you're going to do is you're going to do like butterflies as you go through the motion. And this will work some stabilization muscles as well. Yep, so same thing, keeping that shoulder down. Yep, keep the shoulder down. Good.
Just crease it.
Yep.
And then keep going down like that.
Yep. Awesome. You can keep that shoulder down. Awesome.
Awesome. And then my last, my references were the NASM textbook as my only reference, and according to, it won't show it though. Thank you for watching. Here's my reference. Thank you.